All right, we're back with another practice question focused on the lungs. This is helpful for your step 2 CK, I am shelf or I am comat. Let's go ahead and jump into it. As always, go ahead and pause, read the question for yourself, then we'll go ahead and jump into it. So I've gone ahead and I've highlighted some of the key details from this question, and looking at the end, we see we're trying to find what's found in this patient. So we're going to get a patient presentation and want to know what's most likely associated with it. 50-year-old male presents with a 2-month history of chronic sinus congestion. He's had epistaxis. He's had hemoptysis, which is what chronic productive of blood streak sputum is. He's had wrist pain, fullness in the ears, regular vitals with some hypertension. He has some sinus involvement and nasal inflammation. And they even tell us that he has elevated creatinine. So there's a little triad that you want to keep in mind here that's really helpful for questions like this, or for this particular case, is the renal involvement, the lung involvement, the sinus involvement, and the ears as well. And that combination is what's seen in granulomatous with polyangiitis. So you see the ENT, the gums, the hemoptysis, the lungs, the kidneys. That combo is really indicative of granulomatous polyangiitis. And so with that in mind, it really comes down to what's associated with granulomatous polyangiitis. So looking at option A, increased hemoglobin concentration. This is not typically associated with granulomatous with polyangiitis. Anemia may be seen due to chronic disease and inflammation rather than increased hemoglobin concentration. Option B, increased platelet count. Thrombocytosis is not a characteristic of GPA. It's more associated with reactive thrombocytosis due to inflammation or infection. So B also isn't the best option. Option C is the correct answer. Positive cytoplasmic anti-neutrophil cytoplasmic antibody, c-INCA, which is very associated with GPA, and you probably will see this in a lot of other questions that you do. They'll phrase this differently. Sometimes they just say something along with neutrophils, increased neutrophil count, or they try to make it more vague. This one's pretty straightforward, but it's very characteristic of GPA, so you always got to be on the lookout for something with neutrophil in it or c-INCA or anything of that nature. GPA typically presents with elevated ESR, so D is also incorrect because it's an inflammatory process, so you won't have normal ESR. And eosinophilia is not really seen, or it could be seen in GPA, but it's more characteristic in other conditions like Churg-Strauss or, vasculitis with asthma is another thing it kind of goes by, but it's not associated like c-INCA is. So correct answer C, the presence of c-INCA is diagnostic of GPA. And here's another helpful image that we went to earlier from Amboss, another really helpful resource that just goes into some of the treatment, the glucocorticoids plus methotrexate, as well as the clinical picture we see here. So there you have it. Please like and subscribe. Comment what you'd like to see in the next one, what subjects you want to be covered, and that's it.